Hey guys, Dr. Holly here today. Today I want to talk to you about periods and if you're experiencing cramping, PMS, or any other things. So in this video, I'm going to tell you about what you can do in order to get your body into balance before you have your period so you can prevent these things in the future. If you are getting your period or on your period right now and you're experiencing these symptoms, what you can do as a quick fix. And I'm also going to explain to you the process of what's actually going on inside your body during your period. So starting there, your body goes through cycles of hormones. Some go up, some go down in order to create this space in your body in order for you to have a baby. So right before your period, your body's getting ready for you to be fertilized and have a baby. So it's building up the uterine lining, lots of extra blood flow, lots of extra tissue because it's there so it can support if an egg actually gets fertilized and it can support a baby. And if it doesn't get fertilized, then these hormones start to slowly drop and your body starts to release this extra blood, this extra tissues. And all of that needs to come out. So if you're a person that doesn't get your period, that's super important that we talk to you about it and help you regulate that because it's an important process in order for your body to be healthy. And if you're getting your period and you're experiencing symptoms along that process, then we got to figure out where's the dysregulation. Why is it not just happening fluidly and you are experiencing pain or symptoms along with it? Is it a hormone regulation problem? Is it an input problem? What are you putting in your body in terms of nutrition and supplements? Or is it an output problem? Are your liver, kidneys, and your detoxification organs backed up? But I've had a lot of questions from patients and from friends on what can you do if you're having heavy cramps or painful cramps when you have your period. So while that's super common, it's actually not normal to have cramps with your period. And what I'm going to share with you is super important. And it actually is important about where your body is at the month before you have your period, not the day or the week that you do have your period. It's what kind of position and state is your body in the month before you have your period. In order to have a cycle or a period without having a lot of cramps, you want to make sure your inflammation is down and you're not super inflamed and your tissues are not swelling or holding on to a lot of swelling in them. And to do that, my suggestions are to look at your nutrition and look at what you're putting into your body. So reduce your sugar, reduce gluten, reduce dairy, and go on an anti-inflammatory diet. Oftentimes when I challenge patients to do this for the month before they have their period, the next period is totally fine. Sometimes it's not that simple though. Sometimes we have to look a little bit deeper. So I'm a chiropractor by nature, and so I look at the alignment of the hips and the pelvis and the nervous system for patients. And oftentimes period cramps can come from an imbalance in the nervous system, from an imbalance in the spine and the pelvic floor. So an adjustment can absolutely help what you experience during your period or if you're getting heavy PMS and cramping from your period. Next, I always challenge and encourage patients to increase their cruciferous vegetables. So this is going to be all of your vegetables that are green in nature and leafy in nature. So all those cruciferous vegetables have a lot of B vitamins, they have a lot of iron in them, and they actually help with the methylation process and phase 2 conjugation in your liver and getting rid of toxins and hormones and inflammation. So think of your liver as this trash bag and it has to get rid of all the trash that comes through your body, and it needs vitamins and nutrients in order to operate correctly. So your cruciferous veggies are going to help and aid that. Also, I suggest adding good B vitamins to your supplement regime, making sure that you're getting B1, B6, B12 from a good source, from a food source, and not just from your Costco or your vitamin shop or things like that. My favorite source of your B vitamins is going to be either a liver glandular supplement or actually spirulina, which is my favorite superfood, which I'll talk about later. Lastly, my suggestion is to help strengthen your pelvic floor. So there's a lot of pelvic floor exercises that you can do in order to strengthen and maintain the alignment of your spine and your nervous system when you're having your period. So I talk to a lot of athletes. I was a soccer player by nature myself in high school and in college. And so there's a lot of rocking and damage to that pelvic floor that I did to myself while playing sports, and helping regulate, balance, and create strength in that area actually helped alleviate a lot of the symptoms that I ever experienced with my cycle. And the next thing I want to teach you is, if you aren't able to get your body in the right alignment the day before or the month before your cycle, here are some quick, easy tips that don't create homeostasis and help you inside, but can help in the immediate moment. So if you're experiencing PMS, period cramping, and issues with your period, you can first and foremost get an adjustment. It'll help create alignment in your spine and your nervous system, can alleviate the pain. You can add heat to it. So oftentimes you can get like a rice pack that you can heat in the oven, or I don't like microwaves, but you can do it there. And you can put across your abdomen or across your back. I love a CBD topical cream that you can put right across your abdomen. And or you can use essential oil. So you can use things like lavender, clary sage, or even marjoram oil, and just lightly apply that over your pelvic area in order to alleviate the cramping in those muscles in those areas. Hopefully that's helpful. Comment below, ask us questions, and engage in this audience so that we can help you navigate your health for the future.